Hi, everyone. Thank you for being here today with us. Steve and I wanted to re-record part of this conversation because we had a little bit of echoing on our live session. Just as a reminder, this patient education series is brought to you by Icona Health. Icona is a learning science company unlocking health literacy for patients, kidney care teams. We make evidence-based learning tools designed to help you understand and navigate your care journey. Our virtual reality platform is trusted by patients and care teams in over 250 dialysis clinics across the country. We have these monthly webinars to bring together the community and to share our experiences as patients, care teams, and educators, and to provide on-demand resources at your fingertips whenever you need them. So just as a reminder, my name is Caroline Webb. I'm a lead educator at Icona Health, and today we're chatting with Steve Winfree. He's a patient advocate and kidney transplant recipient about the importance of setting realistic goals. So our learning lessons for today, we're going to talk about the New Year's health checklist and center our conversation around that. We're going to hit on having accountability partners and how much that matters. We're going to talk about some tips for setting realistic goals and celebrating all of your milestones. So we've broken up our checklist into 4 categories. The first one is preventative care. So making sure that you're up to date on current immunizations is so important, especially this time of year. So if you haven't had your flu shot, making sure you go out and get that for this season, making sure you're up to date with your COVID boosters as you're recommended by your physician, checking in on things like the pneumonia vaccine and shingles vaccine based on what your provider recommends and the last time you had those. And then blood pressure checks, incredibly important. You want to see how we're going into this new year and how our blood pressure is. So generally the goal is less than 140 over 90. So just seeing where you are with that and what you might need to work on in the new year. And then height and weight, body mass index, or BMI is usually how you hear it. Good thing to just check in on, especially if you're looking into transplant, and just a good conversation to have with your doctor going into the new year and for goal setting. Making sure you're up to date with mammograms and prostate screenings for men. All those cancer screenings are important for everyone, absolutely, especially if you have a family history of cancer. And also if you're interested in transplant, you need to have those up to date and ready to go for those appointments. Diabetes screening is also a really important thing to go into the new year with, making sure that you know where your A1C, or what we look at when we look at diabetes, where that level is, whether you're falling into the normal range, pre-diabetes, or if you have diabetes, making sure that it's right around 7, less than 7 ideally, is a good goal for the new year. And then having your GFR tested, which that is the kidney filtration rate that we look at to stage kidney disease often. So knowing what stage you might be in chronic kidney disease, and where we want to hold that kidney function for the coming year. Our next one circles around routine care. So having chronic kidney disease, you need to have additional tests and exams done monthly or annually by your nephrologist, and this checklist helps kind of make that more central for you. So having your blood tests done regularly, anytime they're ordered, going ahead and getting them done, making sure you've had them done recently as we head into this new year. Like we talked about, checking your A1C, especially if you're diabetic. Being disciplined with any dialysis treatments that you've been prescribed. So, go into your dialysis treatments and making sure you stay on for as long as you're supposed to, whether you're doing them at home or in the center, just really checking in on that to head into the new year. Any urine tests that need to be done to screen for protein in your urine. If you're in early stages or even late stages of chronic kidney disease, we want to make sure that the protein in your urine isn't increasing, and just have that checked regularly. And then calculating that GFR level, just like we talked about before, to know what stage kidney disease you might be in. And then reviewing the list of medications. This is really important. So talking with your doctor about all your medications, making sure you have a list on you at all times. So for an emergency, or if you just have a question in the pharmacy, anything like that, having a list of your medicines is super, super helpful. So carrying that with you and making sure, your medicine cabinet doesn't have any out-of-date medicine, just all those good things, getting cleaned up for the new year is a great idea. All right. So the next checklist is transplant, and I am so blessed to have Steve with me today, and he has had a transplant. So I'm going to let him take over this checklist for us.
All right, thank you so much, Caroline. Yeah, as mentioned, I'm going to go through here and touch on some of these points in the checklist regarding the transplant list. So, as I'm going through these, know that these are points that a transplant center more than likely is going to look at when determining if you get to be put on that transplant list. And it's also important to remember that every transplant center is different. The ones that we do have listed here are ones you will typically find at every transplant center, but that doesn't mean that there may be a few extra ones that are not on this list. So to get started, as mentioned before, we've talked about height and weight and your BMI. Your BMI is actually very important. That's one of the first things they did check on me when I began the process. They told me that they wanted my BMI less than 30. Fortunately, I was under 30, so I was able to move on past that test. But that is something that is important. So do make sure that's something that you're paying attention to, and something that you do take seriously as you start the new year. We've talked about blood pressure checks. What I would highly recommend, if you are able to, and at least talk to your insurance companies about this, but getting a blood pressure cuff at home. They have blood pressure cuffs that you can purchase at your local pharmacies, at your Targets, Walmarts, and things like that. It's very important to have one of those with you at home so you can monitor that. Um, Third, we've got diabetes and the A1C level. Caroline had touched on this before. You really want your A1C level to be at 7 or below. It's very important that you have your diabetes under control, because diabetes and high blood pressure are the two main causes of kidney failure, right? So if they're looking at putting somebody on the transplant list who could potentially get a new kidney, they want to make sure that you're taking care of yourself and that your levels are where they need to be. So when you do get that new kidney, it's going to be, it's coming into good hands, right? It's going to last as long as it possibly can. And a good indicator is showing that you're disciplined in your diabetes as well. Next, we have dental hygiene. And I admit, dental hygiene was one that kind of threw me off when I was going through the transplant list at Vanderbilt Medical Center. Dental hygiene actually is extremely important to your overall health, because if you get infections and abscess in your mouth, it can cause infection to spread throughout your body. And, if that infection spreads throughout your body, it can affect your other organs, such as your kidney. So it can delay and keep you from being on the transplant list. So you want to make sure you go to your dentist and you have them sign off that everything looks okay, because then you'll take that letter or whatever it may be and you'll take it to your transplant center. Next, you've got non-smoker and drug abuse. You want to make sure that you're not smoking cigarettes. You're trying to stay away from vapes. And then with drug abuse, it's exactly what you would imagine. No recreational drug use. Make sure any medicine that you take over the counter is approved by the transplant center, because you don't want to accidentally take something that's over the counter, them test your blood, and then something come back that's kind of funky, and they say, you know what, this could keep you from being on the list for the time being. You're going to have to come back and reapply just because you took something that was over the counter that wasn't approved. So make sure that everything that you do put into your body is approved by your nephrologist and the transplant team. And lastly, I want to talk about discipline with dialysis. And what I mean with discipline with dialysis is, if you go to the in center for hemodialysis, that you're making all of your sessions. While you're there, you're doing what you need to be doing. You're not asking to leave early. You're not showing up late. Just making good decisions to show that it all goes back to showing that you have the ability to do what you need to do to make those right decisions that will ultimately take care of that new kidney that you get, because they just want to make sure that it's going to last as long as possible for you. And that's really what it boils down to. So when we talk about discipline with dialysis, it really is just doing what you're supposed to be doing, making the right decisions, which for you all watching this, I have no doubt that you guys do that because you're taking the time to learn even more about what you need to do for the new year.
Absolutely. And just a reminder, we had a really great conversation with Dr. Becker and Dr. Butt. So they talked a little bit about more the clinical side of transplant listing and all those things. So if you haven't checked out that video, definitely go ahead and do that. And we have a great 2-part series talking with Steve and in depth about his journey as well. So if you're interested in transplant and that's something you want to learn more about, check out those videos as well. All right. Our final checklist is talking about mental health, which is so important. And Steve is such a great advocate for mental health and chronic disease. So I'm going to let him take it away.
All right. Yeah, as mentioned, mental health care is something that I care very, very deeply about. I wholeheartedly admit that mental health is something that I have struggled with as a dialysis patient, and just as somebody who's chronically ill. So I take this stuff very seriously. So when I talk to you all about this, I want you to understand that how important this stuff really, really is. And I really want to see you guys go through this checklist and make sure you're doing everything that you can as well. So what we have first is setting small attainable goals. And what I mean by that is, let's say we're going to work on our diabetes, right? And we fully admit, you know what, we could be doing better. Maybe we're drinking too much soda. Maybe we're having too much bread. So what we're going to do is say, all right, every day I've noticed I'm having a Coke or a soda or whatever it may be. So I'm going to cut that down in half. So for this month, for the month of January, I'm going to go from having a Coke every day to maybe having 2 or 3 a week at most. Okay. And then once you get to the end of the month and you're able to accomplish that, you're going to feel a lot better, right? Because you're able to obtain that goal. The worst thing you can do is set up goals for yourself that are unattainable, because then it really affects your mental health in regards to feeling hopeful, to feeling like this is something that you can do. And we want to avoid that. So that's why it's really important to do small attainable goals. And we'll talk about this in a minute and celebrate those goals. Next, we have de-stress from the company of others. I think that is very, very important, especially for those of you on dialysis. Dialysis can really affect your body. It can affect our bodies and make us, tired. We can feel nauseated. We can feel groggy. We could just kind of feel blah, right? And so we need to give our bodies that opportunity and that time to de-stress. And so what I recommend, and this is actually something that I used to do, I would ask my wife for 30 minutes of just me time. And what that would consist of is me either reading or writing. And I would just take that time to kind of recoup and regather myself from dialysis. And I always compare it to a professional athlete who takes an ice bath after a game, right? They're doing what they need to get their body to recuperate better, and to recover from all of the, the pounding that the muscles took during that game. Well, think of your body as the same way. Your body goes through a lot when it goes through a dialysis session. So you want to make sure you're taking time to allow your body to rest so it can recoup for the next day. Next, we have celebrate the big and small wins. And I love this. This is one of my most favorite things. And this goes back to setting small attainable goals. Not only is it important to make sure you set goals that you can achieve to help with your mental health, but it's also extremely important that you celebrate those wins, right? So what I recommend, you don't have to go and throw a big, massive party every time, you obtain one of your goals, but it's okay to definitely give yourself a pat on the back. Maybe go out to your favorite restaurant, maybe get your favorite snack that's been approved by the transplant team, maybe invite your accountability partners over, maybe share in the good news with your care team and your nephrologist and your transplant team, to let them celebrate with you, because it's so important that as kidney patients, we go through so much. There's so much hardship that it's really important that we allow ourselves to celebrate ourselves once you're accomplishing these goals. I think it's really important for your mental health, especially as you continue to go through that journey. Stay well rested. That kind of goes back to the de-stress. You want to make sure that you're staying rested and you're, again, giving your body that opportunity to recuperate. And next we've got, how do you recharge? That is a great question. And so what I'm going to tell you is, again, some of the things that I would try to do. For me, recharging is making sure that I took time, and I make sure that I take time to be more than just a patient, right? So I want to take time where I'm not thinking about dialysis, I'm not thinking about my kidney disease. I'm solely focused on whether it's a hobby or spending time with my son, or maybe watching my favorite TV show, maybe getting an opportunity to read my favorite book, and completely taking my mind away from being a patient. Because you want to look at yourself as more than a patient. If you want other folks to look at you as more as a patient, then you have to make sure you do that for yourself as well, right? So make sure you take that time, and like I said, read a book, write, spend time with family, watch a movie. It's very, very important for your mental health to give your mental health a break from what's been causing you the stress and things like that. And lastly, we have accountability partners, and I love the idea of accountability partners. For me, my accountability partner is my wife. She's a phenomenal accountability partner. You want to make sure you have an accountability partner who is going to be honest with you, right? And I believe Caroline and I are going to talk a little bit more about that here in just a moment.
Yeah, absolutely. Well, thank you so much for sharing those. That's an incredible
Mhm.
list and great way to go into the new year. So, but exactly about accountability partners. Um, I know your wife is an incredible accountability partner. What are some examples of accountability partners that might be outside of our home or our immediate circle?
Yeah, and let me say that too. Like, your accountability partner doesn't have to be a family member. There's all kinds of resources and opportunities for wonderful accountability partners. First and foremost, let's talk about Icona Health and the folks here at Icona. I know we would love to be that accountability partner for you guys, that person for you to reach out to if you have questions, that person that you can reach out to, again, to celebrate those small wins and those goals. You can also reach out to your care team. Um, that should be wonderful accountability partners, your nephrologist, your transplant team, anybody that's within that care circle that you have can make a great accountability partner. And lastly, and one that I think can be most important, is having a fellow dialysis patient as your accountability partner. Because what you find happens is, while you're taking the time to account for somebody else and making sure they're doing what you're doing, in essence and indirectly, it helps you to stay on track with what you're supposed to be doing as well. And I do have a couple of accountability partners who are also dialysis patients.
Awesome. Yes, there are so many sources for accountability partners. So going into the new year, everybody, think about who those people are, and if they're not the honest, helpful, accountability partner that you need, maybe reaching out to other sources that might be. Steve, have you ever had an experience where maybe you needed a different accountability partner, or have you ever been in that situation where you maybe needed to replace someone?
I have. I did one time. My nephrologist that I had, wonderful doctor, wonderful man, great human being, but just with his particular bedside manner, it wasn't a great fit. I'm somebody who loves to talk, who loves to ask questions, and who loves to dig deeper into what I'm told. And he had more of a bedside manner of, he would come in, he would say, okay, you've got this, and this wrong. This has gotten worse. And then he would kind of turn around and leave. And that, I just, I need that conversation. So I realized that it wasn't a great fit for me, and that what was best for me, and what I like to call self-care, because self-care is not selfish, okay? It's not selfish for you along this journey to say, you know what, I need to make sure I make the decisions that are best for me. And in this instance, what was best for me was switching nephrologist, to actually another nephrologist in the office who I grew up with. And that turned out to be the absolute best decision I had ever made in my journey, because he's still my doctor to this day. If it wasn't for him, I wouldn't have been pushed to do the preemptive transplant, and I wouldn't have gotten a lot of what I've gotten had I not done that. So yeah, it's really, really important to make sure you're taking care of yourself and making decisions that are best for you.
Absolutely. I think that's an excellent point. Having trust in a situation that's stressful and having chronic disease and can be overwhelming, you definitely want good team members, good accountability partners. So 100% agree. Well, good. I think we talked about it a little bit, but can you just touch on how you set the attainable goals and celebrate them going into this new year for you?
Yeah, so one of the goals that I have set for myself is I want to try to lose a little weight and I want to work on my A1C. Um, Part of that goal setting for my A1C is making sure that I get that checked at least every 3 months. Because Caroline, please correct me if I'm wrong. The A1C is an average of 3 months, correct?
You're exactly right. Yep.
Okay, so yeah, so you definitely want to make sure you're doing that every 3 months. That's what the goal I've set for myself. In regards to losing weight, this, again, a lot of us when we say, okay, we want to lose weight, we want to try to lose as much as we can, as fast as we can. And everybody's body is different. And sometimes that's not possible to go in and say, I'm going to lose 30 pounds this month. That's just not a realistic or possibly healthy goal, right? So on top of making realistic goals, you want to make sure you're making healthy ones as well. So I may say to myself, and when I say I have, I want to lose 5 pounds in January. So what I'm going to do is I'm going to start off by saying, okay, what are some small things that I can change moving forward? And for me, that is maybe only having 2 or 3 Cokes every couple of weeks, and setting small goals like something that I know that I can obtain. Um, and the reason I know I can do that is because I also know my body. You want to make sure that when you're setting out to set these goals, you have an understanding of who you are as a patient and your body and knowing your body. Your body will never ever lie to you. And so it's important for you to know that and to understand yourself, because if you know your limitations and you know what your body can and can't do, it helps you to make these smaller goals easily attainable.
Absolutely. Well, thank you so much for being here today with me and having this discussion. And I really wish everybody a very happy new year and great success in any goals that they set in the new year. We'll still be here doing monthly webinars for you. We want to be your accountability partners. So join us for future sessions and hopefully many future sessions with Steve too, because I love speaking with you.
Thank you very much. I appreciate you all having me.
Absolutely. And you can reach out to us. Our contact information is here on the screen. And again, Happy New Year, everybody.
Happy New Year, everyone.